everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a medication known as Desipramine. Its brand name is Norpramin. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Desipramine is a tricyclic antidepressant, or TCA, which is indicated in the treatment of depression. Its exact mechanism of action is unknown, though it may block the reuptake of serotonin as well as norepinephrine. Desipramine does not inhibit monoamine oxidase. So in terms of indications, I did just kind of mention it there. It is indicated to be used in the treatment of depression. Now, before somebody was to use Desipramine, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. This medication cannot be used during the acute recovery period following a myocardial infarction or a heart attack. Desipramine would also be contraindicated in patients who have used a monoamine oxidase inhibitor in the previous 14 days. And lastly, for contraindications, it can't be used by patients who have a hypersensitivity to Desipramine or to benzodiazepines. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medications that the elderly population should use cautiously or avoid. Because this medication has anticholinergic side effects, as well as sedating properties, it would put this population at an increased risk of falls, therefore fractures. Orthostatic hypotension would also be a concern in this aging population. It's recommended to give lower doses when this medication is used by adolescents. Patients using this medication who have a history of cardiovascular disease may be at an increased risk of experiencing arrhythmias, tachycardia, stroke, conduction defects, as well as an acute myocardial infarction. There would be an increased risk of experiencing serotonin syndrome if a patient is using Desipramine along with other medications that also affect serotonin levels. Because of the anticholinergic side effects that Desipramine does have, it could make glaucoma as well as urinary retention worse in patients who do have these disorders. For patients who have schizophrenia who use Desipramine, they may be at an increased risk of experiencing more or worsening psychosis. Patients with impaired renal function would be at an increased risk of experiencing toxicity. It's recommended to discontinue this medication before somebody undergoes elective surgeries, as it could put them at an increased risk of cardiovascular events such as hypertensive crisis. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Desipramine, they can expect to take it in tablet form. When patients are using Desipramine to treat depression, they can expect to take 100 or 200 milligrams either once a day, or it can be divided up throughout the day as well. The goal here would be to start off on a low dose and then increase it over time as long as the patient can tolerate the increase in dose. The maximum dose in this situation would be 300 milligrams daily. As a quick note, I should mention that doses of 300 milligrams a day should be initiated in hospital. When patients use Desipramine for its off-label use in the treatment of diabetic nephropathy, they can use 25 to 150 milligrams in either one dose or in 2 daily doses. For post-herpetic neuralgia, again another off-label use, the dosing would be the same, 25 to 150, either once a day or twice a day. As with all medications, there are some side effects that patients may experience while using Desipramine, so I'll list off some of those here for you now. Constipation and xerostoma are possible. Some patients experience dizziness or somnolence, even blurred vision. And fatigue would be another common one with Desipramine. More serious and rare side effects would be myocardial infarction, cardiac dysrhythmias, agranulocytosis, thrombocytopenia. Some patients may experience hypersensitivity reactions, and then worsening of depression, as well as the development of suicidal ideation, would also be serious side effects. That's all we're going to talk about today with Desipramine. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable, you can help me grow this channel by liking the videos, sharing the videos, and most importantly, subscribing to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.